Morning everyone, Colin here from Evolution Hair Clinic. I hope you are all having a great week so far. We're on Friday, so weekend's upon us, so which is good. Although kids are off school, certainly here in Scotland, so we've got 2 weeks of madness. I've got a little bit of time before I'm not due in the clinic for another hour or so. So I thought I'd come on and make a quick video because something that I get asked this quite often. So a lot of times I'll get clients into the clinic who are on the fence and they're trying to decide whether they go for SMP on the one hand or whether they go for a hair transplant on the other hand. So I thought I'd make this little information video about the kind of advantages and disadvantages to each. Just so that if anybody is sitting on the fence, it means they can maybe make a more informed decision. There isn't a right and a wrong answer here. Now, I'm an SMP artist, so obviously I am biased towards SMP, right? So I'll just get that out there. I think it's a better treatment, and I'll go into a little bit of detail and why I think that. Now, do you know, if you're dead set on getting a transplant, then absolutely fine. But I'm going to kind of give you a bit of an insight into why I think it doesn't work as well. So let's start with, let's see the advantages of a hair transplant. So the advantages are it allows you still to have longer hair for the most part. It's real hair. You can't argue with that. SMP, this is an illusion. It's not real hair. It maybe looks like I've got a shaved head, but obviously I've not. Well, I've got a shaved head at the sides and the back. This is my real hair, but this on top is obviously SMP specialist type of tattoo that makes it look like you've got a shaved head. So I suppose that's the main advantage of a hair transplant, is that if it works, yes, it's real hair and we can't compete with that. And also it allows you to wear your hair longer because not a lot of people are ready to have the shaved head look. I see it, it's common, you know, I see it in even my own younger brother. My own younger brother, he's getting to a point where his hair looks ridiculous, but the thought of him having a shaved head, I don't know if he thinks it makes him look thuggish or whatever, but I think even a lot of these people, when they're trying to hold on to the hair, just shaving their head, just doing that alone without anything else would make it look so much better and they'd look so much younger looking and not as old looking. However, I get why people have transplants. Sometimes especially with younger generation nowadays, sometimes their hair, it becomes so ingrained as part of their identity that the thought of living without any hair or with short hair, it's like the end of the world to them. So I understand why people are thinking about transplants. So yeah, advantages, real hair, and you can still keep your hair longer. Now, what's the disadvantages to a transplant? There's a lot of disadvantages to a transplant. So first off, it's surgery, right? Half of my business in the clinic is people that have had transplants previously, right? So I have a lot of experience in talking to these clients about their experience, whether they got it in Glasgow, whether they've went down to London, or whether they've flew over to Turkey. So I hear a lot of the negatives. So first and foremost, it's a surgery. So it's invasive. Do you know, they are literally taking little chunks of skin. So so there's two different transplants that you can get. You get an FUT and an FUE. So the FUT is the older way. We don't see that very often now. And that's where they take a strip of skin out the back of your head. That's old school. There is some clinics in Turkey that still do that, but we don't see it that often. Now, one of the disadvantages to an FUT is if you do get it, even if it's a successful transplant, is that you'll have this kind of strip going along the back of your head, like a big scar. It looks like a smile going across the back of your head. So that's one of the disadvantages to the FUT. Now, albeit they're rare nowadays, it's mostly FUE. Now, a lot of transplant clinics will tell you, oh, we do it the new way, we use FUE, and so that means that you won't have any scarring. No, you still have scarring. You cannot get, there is not a transplant on this planet that you can get that doesn't leave scarring. The difference is, with FUE scarring, It's not as textured and it's not a big strip going across the back of your head. Instead, it's lots of tiny little circles. Now, the problem you've got with it is this scarring, even though it's a lot more subtle than FUT, it's still, the scar tissue always heals lighter than the skin surrounding it, so you can see it. Right, now that means that even if you have an FUT hair transplant, you can't have like the skin fade or anything at the back, because you'll see this it almost looks like a rectangle of lots of little white circles. Now, don't get me wrong, if you've got darker skin, then that contrast between the colour of the scar tissue and your skin is more, so you see it more. If you've got lighter skin, you see it less. And it's the same with hair. If you've got really dark hair, that contrast is quite obvious, so you need to keep your hair quite long at the back in order to hide it, because you can see the difference between the white on the scar tissue and obviously dark hair. Whereas if I've got somebody that comes in and they've got like light skin and sort of dirty blonde hair, you can see the scar a lot less. However, everybody ends up with this scarring. And that's fine if you're planning to grow your hair and grow it a little bit longer at the back, because then the hair that you've got remaining in the donor area, that's quite good at hiding it, as long as your hair's a certain length. So that's one of the disadvantages. You always end up with scarring, and you can't wear your hair in a shaved head look at the back, as in a skin fade or a gauge 1 or whatever it is that you usually wear at the back of your head. And one of the other disadvantages is people go and they get, like, say they get transplanted hair put in the full top, and they honestly expect to have this full head of luscious hair. And it's very rarely the case. Yes, you will have hair over the full top, but you imagine somebody with a full head of hair on the top. You've maybe got 200,000 hairs, right, going along the top of your head. When you get a transplant, the average is about 4,000 grafts. So imagine going from 200,000 strands of hair to 4,000. So yes, you'll have hair on the top of your head, but it will always be thin. And it will always look, if I was looking at you and you had a hair transplant, I'm still going to be able to see the shape of your scalp. You'll see your skin through the hair. So as much as it gives you hair, you can still see that the hair is really thin. So that's another disadvantage. Sorry, my phone's going there. Another disadvantage is that it's really painful. It's not so much what I hear. This, again, I'm only going on what clients tell me. It's not so much sore getting the transplant, but see the local anaesthetics, the jags that they give you in the donor area, and obviously where they're implanting the hair to give you, it's that's really painful. And sometimes it's about 60 of these jags. And what clients give when they feed it back to me is they tell me is that it feels like somebody's putting a needle in and hitting your skull, because it's so the actual local anaesthetic is the painful thing. You're also going to be sitting on this like a table or a bed whilst they do this for an entire day. It's 12 hours. So that's another disadvantage. It's a long time. If you're going to Turkey, you've got the flights out, you've got the hassle of airports, you've got to fly out there, you've got to then sit there for a full day. And then you've got the recovery time. The recovery time, like you see a lot, if you've been on a flight back from Turkey, you've seen it before. People with like their heads swollen up like balloons and all the rest of it, and weeping like blood with big bandages around their head. It's a lot for something that might not even work. And that brings me on to the next thing. A lot of the time it just doesn't work. You get shock loss. You always get that with transplants, where once the hair's implanted, it'll fall out and then it regrows. But sometimes it doesn't regrow. And you might have spent 3, 4, 5, 6,000 on this transplant, and then it just doesn't work. So you're always kind of taking a chance. So it's another disadvantage is it going to work? Am I going to pay all this money? Am I going to go through all this hassle, all this pain, all this discomfort, all the time to travel to Turkey and back again, and then I find it doesn't even work and I've wasted my money. So there's that as well. And here's the thing that most people don't want to hear, and this is 100% true. All transplants, every single one of them, 100% of them fail in the end. Now, here's what I mean by that. I don't mean that the actual transplanted hair is going to fall out. I don't mean that. Most of the time that will stay for your entire life, especially at the front. Not so much at the back, but especially at the front. But what I mean by them failing is, people go, they might be receding here, say you're in your late 20s, early 30s, you begin to recede there, you think it's the end of the world, so you're like, right, I'm going to get a transplant. You go over to Turkey, or you go down to London, or wherever it is that you go, and then they take hair from the donor area, and then they put it here. And then what happens is you start to recede more, or you start to begin to lose it on the crown. So then what do you do at that point? Your options are that you leave it, or you go back for a second transplant. So let's just say in this scenario that you go back for a second transplant. So one, they're taking more hair from the donor area. Now they don't just take it from the back, they take it all the way around to the back of the ears. This is where I see the scarring going. And occasionally I see it creeping past the back of the ears. And it's really obvious to anybody. You can see the scarring. But let's just say you get a second transplant because your crown's beginning to go, or you're receding a little bit more. And then let's say it's successful and it works, and that's fine. So you might be fine for 6 months to a year. You've probably spent at this point 8,000 or 9,000 on 2 transplants, right? I'm guessing. But then it looks great. You're like, yes, I've got my hairline back. It's not receding any further. But then what do you do when that hair that you've got, not the transplanted hair, but the remaining hair on the top falls out? Because once your hair starts to go, once you start losing your hair, it's only going to go in one direction. It's not that it will suddenly stop. You're going to keep losing more hair. And when you lose more hair, you're going to keep the transplanted hair, but lose the rest of the hair. And then it's going to look ridiculous because you're going to have this tiny bit of hair going across the top, but nothing else because the rest of it's fell out. And then guess what happens at this point? For 99% of people, they're like, this looks ridiculous. I've now got no choice but to shave my head. So they then go, right, they bite the bullet. They're going to shave their head anyway. So they've delayed it by maybe a year or 2 years or 3 years or whatever it is. But then they end up having to shave their head anyway. And then what happens? They've then got all this scarring on the back of their head. You've got scar tissue here where the hair's been transplanted into. And when it's shaved down, what you see is tram lines of hair that's been implanted, because it's usually 4 or 5 hairs coming out like the one follicle. And so you see these dark dots because there's more than one hair there. And then you've got all this scarring that is then really obvious on the back of your head. And then you have no choice but to then come and get SMP to have it camouflaged. So not only have you paid whatever, a few thousand to get your transplant, it's failed in the end. Now you've got all this scarring that you've then got for life. And then you've got to come and get your SMP, so you've got that cost on top of it. So this is the disadvantages to hair transplants, and it's why I'm not a fan of them, because they all fail in the end. And they all end up with scarring. Every client ends up with scarring in the back of their head. So what's the advantages to SMP? A few different advantages. Disadvantages, let's go with the disadvantages. One, it's not real hair, okay? That's the main disadvantage. It's an illusion, it makes it look as if you've got real hair, but it isn't real hair. That's really the only disadvantage. On 2, you need to go with a shaved head look, but most people are at a point where they've no choice but to do that anyway. What are the advantages? There's no surgery, it's non-invasive. You could have your SMP treatment today and be back at work tomorrow. The risks are far less because it's not surgery. It works 100% of the time on everybody. It's not, will this work? It works on everybody. So it always works. It doesn't matter what your skin tone is, doesn't matter what colour your existing hair is, it always works. And you can be done and dusted in 2 weeks. So you have a session, leave a 2-week gap in between, and then have another session, and then that's you. You've got this look of a full head of hair. Your face is framed again, so you've no longer got this forehead that goes on forever, and then you don't need to worry about it. Now, I suppose another disadvantage is it does slowly lighten over the years. So every 4 or 5 years, you might need to come in for a wee sort of 2-hour colour boost touch-up. But we actually think that's a good thing, because as your hair, your existing hair that you might keep at the sides and the back is lightening as you age, as it goes greyer. It means when you come in for a touch-up, we can just match how your hair is at that time. So we're always staying roughly in line with where your hair is. So there's a lot of advantages to SMP, and it does what it says in the tin. It's not a miracle cure, but we'll make it look as if you've got a shaved head. It'll make you feel younger, make you feel healthier, and I think it's by far the best treatment for hair loss. So I hope that helps, and I'll see you in the next video, and if you've got any questions, get in touch. Okay, thank you guys.